Hi, I'm Joe Rice, 61 years old, and I had a stem cell injection just about 4 months ago. I want to share this with everybody, let you know that there are other alternatives to surgery. Uh, when my case started out, I had excruciating pain for, I guess, the past year. It had been building up for many years before that, but finally got to the point where I was in constant pain with my shoulder. I had an MRI done. The MRI showed massive tears, rotator cuff, something's torn into the bicep. They had words I never heard of before in this MRI, about 3/4 of a page long of issues that I have. So I figured, okay, my next step is I have to have surgery. I went, met with a surgeon. He looked at everything and took a few x-rays and said, you know what, I can fix all those tears for you, okay, but you're still going to be in pain because your issue is that you have no soft tissue left in that joint. You have bone on bone, where most bones are rounded off. Mine is flat, just like my hand is. So it's all ground off. It's just rubbing in a joint, causing that irritation. So he said no matter what I do to correct that issue that you have with your tears, you're still going to be in pain. So, well, there's got to be some solution. He said, yes, we can do a shoulder replacement. Full shoulder replacement is a pretty major surgery. Didn't want to go through that. Of course, recuperation is quite long. They can only do that surgery twice in your lifetime. I know I'm not a young guy, I'm 61, but I could probably see myself having it done again at a later date. So, seeking alternatives, just so happened I saw that Dr. Morris was doing a seminar near my house. I went and listened to that. Said, wow, this is like the next best thing. I never heard about stem cell injection. I mean, I had heard about it, but didn't know exactly what it was. So I learned a lot more about it from him at that seminar. Did a lot of research on my own. Then I went in for a consultation with Dr. Morris. Hit him with a lot of questions, a lot of things that I was not sure about. He answered everything I had. What I wasn't skeptical about, my wife was. So kind of like we were kind of double teaming. Got a lot more information. Went home, did more research, shot Dr. Morris more questions, wanted to know about the tissue bank. I mean, we asked everything. Took about a month and a half, and I was really satisfied that this was probably the best route for me to go. I had it done, like I said, about 4 months ago. And on a pain level now, I'm probably about 25% the pain I was back then. There are things I'm doing with my arm that I couldn't do before. I do enjoy working out. I like weights. I was doing less and less each month prior to the surgery. Now I'm back to doing what I did before the surgery. So I think I've had an amazing recovery, and I can't see it stopping here. I think we're going to keep going forward. So anybody who's contemplating and thinking about it, I really advise it. I think it was the best move I made so far. And just remember, surgeons are in the business of doing surgery. So they're probably not going to try to talk you out of it. If you're able to, it's a great thing to try.